este webinar número 193, desde que el Organismo Andino de Salud Convenio Hipólito Unanue inició el ciclo de
The
seminarios.
Andean Organization of Health started the web seminars in May 2020. We are working in a constant learning process for 3 years now. Every 5th of October, we celebrate the Peruvian Medicine Day. And so on top of congratulating our colleague, it's especially pleasant to present this webinar, Medicine and Public Health, Advances and Challenges. The pandemic of COVID-19 also teaches that the capacities that we built and were reversed during these 3 years should not stop, but we need to continue with health coverage in the center of the policies, research and epidemiological surveillance, the development of vaccines and pharmacological items, and public health measures and prevention strategies are extremely important for all relevant priorities for the region. We can find some of these advances in the monthly bulletin that is available in the website of the Andean Organization of Health. I will invite you to leave us your name, the organization that you belong to, and the country that you are joining us from. In that same space, you can leave your questions or send them to our email, webinarhorascono@gmail.com. In this webinar, we will follow the usual dynamic. We will begin with the institutional greeting, then the dissertation of our speakers, and then we will move to the Q&A space. I would like to remind you that to access the certificate of attendance in any of the Facebook Live or YouTube Live chats, you will find a fixed link where you must fill out a short survey and leave your information and email. Please verify that your email names and surnames are spelled correctly so we can send you the certificate, and that will be sent during the following days to your emails. I would like to use this time to introduce myself. I'm Patricia Jimenez. I'm the coordinator of monitoring and evaluation of the strengthening project of diagnosis for tuberculosis in the Americas in the Andean region of health, and very pleased that this afternoon I will be in charge of moderating this webinar. We had some last minute problems. Manuel Alcalle Dávila, the Andean secretary, had the responsibility of giving us the welcoming remarks, but unfortunately she had a technological difficulty with the internet, and she sent me their notes so I can share with you their opening remarks. So I will read them as they send it. Talking about the challenges and advances in medicine and public health, in a special date such as today, where we celebrate the Day of Medicine, it's an invitation to rethink and what we need to recognize and what we need to change so we can be at the level of what society expects from us in terms of public policies. I'm sure that our presenters today will show those successes and challenges in front of the complex reality to respond to the population requests of climate change and healthcare issues. And this, of course, not going to be treated apart from the inequalities that we suffer that we face in our country. So we don't need only public health policies, but comprehensive protective social systems that will guarantee the access to every citizen to a quality service. And that, of course, includes a social pact, state policy in the long term, and an understanding by the government and every single sector of the society about the importance of put health and life at the center of the decision making. I could not leave behind and think this October the 5th, the figure of Daniel Alcides Carrión, the Peruvian hero that is an inspiration for the public health workers. And honoring his example, we are here to keep working for the well-being of our communities and the Mother Earth, to share this space of solidarity with a constant learning experience from ONAS CONU, and together we are stronger, and together we will reach farther distances. Those are the words from Dr. Calle, and after this opening remark, I would like to open this seminar, inviting and giving a warm welcome to Álvaro Rodríguez, our first speaker, who is president of the Latin American Network of Person-Based Medicine. This is a member of the Medical School of the National School of Colombia in Bogota. And of course, always welcome to our webinars and our discussion.
Gracias, doctora Patricia. Una buena tarde.
Thank you, Dr. Patricia. Good afternoon, everyone.
Para mí constituye un honor y un placer estar
For me, it's an honor and a pleasure to be with you, to share with you this topic of medicine and public health advances and challenges. Something that I will share with you today is related with mental health, one of the main essential components of the state of well-being and functioning of every individual and every society, and fortunate enough has become a debatable topic and was put into knowledge of every single individual trained in the sanitary offices. It was very difficult to find spaces where we can talk about this topic, so I will speak about some historic, conceptual, and clinical items. And during this following 20 minutes, I hope to share with you a panorama of what is happening and motivating some public health actions. I would like to thank my helper today to help me with the slides, and we can move to the next one. Thank you. So my name is Álvaro Rodríguez. I am a main professor of psychiatry in the National University of Colombia, in the faculty where we defend the human medicine center in the person, and we are sharing this perspective with every place that we lecture. And of course, we need to include, we cannot talk about medicine without talking about technology and the main aspects of our professions and other sanitary areas. Next, please. Well, this, of course, is something that we all know. Medicine started from pathology, and specifically came from the 5 main indicators of pain. So for many centers, we were concentrated in the clinical service and the individual service. And of course, this is extremely valuable for everything that we are doing. And now we are involving little by little, during the last decades, the studies about physiology, public health, epidemiology, and prevention. So we moved from the individual clinical service centered in the pathology to include more complete, more holistic patterns and more integrative approaches. So in psychiatry, of course, every initial effort needs to be analyzed in this type of pathology, and of course, these are quite frequent, especially the ones that we are including during the last couple of years, dealing with very complex situations and what mankind is suffering in terms of many pressures that human beings are suffering along the way. So what we have been managing is the depression, with attempts of suicide, and today the stress that we are dealing with, some severe diseases such as psychosis. We have identified many personality disorder, people that adopt inadequate attitudes and they keep them during the entire life. Drug addiction, one of the great modern pandemics, are growing and, of course, destroying people, families, and societies. And of course, we are confronting situations of people that are completely disadapted. Why? Because human beings are dealing with some situations due to this huge phenomenon of modern migration. Historically, as well, we find that the family conflicts and couple conflicts are also involved in this process or this crisis. So we are filled with psychosocial problems. We all know them. We all find them every country we go. And when we mention that people suffer from them, we will find multiple solutions for them. The fact that we have a lot of inequalities in the world among countries and in the same countries with different population groups, poverty it's still quite huge, and we all understand the negative impact of poverty in every single health domain since its conception until the good treatment approach. So we also improve, but we find that they are unsafe or so. Of course, we will also find feeding problems, something that turns extremely incredible, maybe a little exaggerated. It's like when Latin America wanted to. So everything here promotes health and physical and mental health issues, and of course the economical situations and the economical pressures that we are exposed to generate some stressors. And of course, with all the problems and issues that we deal with, the calm habitat and warm and fraternal environment that we should living at is every time more distant from us. We know, of course, that during the last decades, narco traffic, the circulation of very toxic substances, and every time we have more people that consume them. And this, of course, influence negatively in all the situations. And of course, we have huge indexes of illiteracy. And the literate one, they suffer from a very unfair pyramid because very few of them go to university. And of course, very few of them will do post-graduation studies. Unemployment, with all the impact, is still one of the more frequent situations in our countries. And for health services, they progressed without any doubt in every single domain. They are still huge issues in population that do not have access to quality healthcare, of quality healthcare services that are organized enough for our population in every single country. We have this differentiated situation that force us to receive private services of quality, but unfortunately, the healthcare attention is not And of course, we see that many sectors of the population, many sectors of our countries are not having those advances, and it becomes a sign of modern times, the stability of social and economical situation that countries that we have uncertainty about, and situation of alteration of mental health, and of course physical health as well. Why? Because there's a key aspect that we are insisting upon. The stress kills us, but before killing us, we get sick by stress. So almost every single disease that we suffer from, and we know that we manage the general classification of diseases from the WHO, and they are classified between 2000 and 2400 diseases. And all of them, when we have stress, they get more, we have more issues, and many of the disease courses are more complicated due to the stress that we suffer. Next one, please. And the situations that we are dealing with around the inequalities are also quite general. We understand that the sanitary staff do whatever they can. And of course, we have an important objective because of the difficulty that we have to deal with. And of course, there are some individuals that do not have ramps to transport people because of the transportation issues that we have. And of course, and once we have, when we have to look for a health care service setting, it's quite difficult to find them. And not every single patient will have the possibility of being received or being treated. And technology, of course, is a wonder. The proper usage of technology is improving the medical services. But if technology is displacing the personal attention of our physician to our patients, if we forget about the human touch of this patient in pain, the consequences will be many, many times extremely negative. And of course, we consider the economical aspects of it. But when we only have this type of approaches, we need to include the economical component. And many patients in every single place of the world, I know that many of the physicians that are joining this event know what is happening around our world. We can say that you were not properly treated, they didn't look at you, you didn't have an examination behind you. So the scared time of attention also have like a conspiracy against the proper attention in health. And of course, an inherent bad communication on top of that make us vulnerable, and that complicated the entire service of health. And you can complain about the changes. You don't have the permanent physician that used to treat you, or a legion of people that it's at your service. And of course, you don't have the previous elements. So the attention of health is unfortunately completely disconnected. And we have more than 140 specialties and subspecialties in medicine, according to the American board, and some of them are not recognized. And that has the issue.
Sin embargo, desde el punto de vista del paciente, eso
And from the point of view of the patient, it can generate a problem from side to side, from a specialist to a specialist, and at the end, we will have patients that feel that they are not treated properly or a comprehensive manner. Next one, please.
Recordemos las definiciones sobre salud que todos conocemos.
Let's remind the definition of health. Andrija Stampar said that health is the full well-being, not only the absence of diseases. So that is a brilliant definition, and of course, it goes together with the physical definition of the last decade. And of course, we need to understand that this is a paradigm shift. This is the ideal, it's a goal, but the fact that, as I mentioned before, we are unable to have a proper approach. And of course, we try to include a definition of health, including environmental and spiritual components. And of course, we're talking about the environmental and mental health. And today I was participating into a Venezuelan meeting where many people were discussing about something recent and important. One of the signs of contemporary times, digital health. That is a term that from some time the health treatment is using communicational technologies that will guide us through artificial intelligence, informing through many channels, many communication channels, and divulgation of information that is not always certain or precise, that might bring some unnecessary concerns, but also we are giving a warm welcome to artificial intelligence, properly used, that is starting to change our entire culture in many aspects, and the medicine day by day is benefiting from these technological changes. So regarding mental health, there are many definitions that involve the psychological well-being. We were talking about mental disease a previous minutes ago. And of course, we need to distinguish mental from physical health. And of course, every individual will have access to mental and physical health. And of course, how can we know that we have mental health? And the possibility of development. And of course, due to the Howard Gardner studies, we have multiple capacities, and of course, not all of us have the possibility of having growth or vitality. And of course, we have the possibility of developing those capacities. Another important component is that this definition that are far from ideal move away from the daily living. And of course, it doesn't mean that we don't have issues. Every one of us as human beings have issues, and if we have tensions or pressures, we have stressors. One important element today, we consider that the human being can cope with the daily tensions. We cannot spend the entire life just doing nothing. And of course, doing some work, this is something that help us to develop our mind and our well-being. And of course, this is a matter of giving the best what you can to the comprehensive development, and also the possibility to contribute to the community.
Recordemos lo que decía Aristóteles, la salud mental es...
Let's remind what Aristotle used to say. Happiness is the meaning and the purpose of life. So every time we're saying that people, so we are moving through this valley of tears, is not only suffering, but we should experience. And of course, people have requests of happiness. Happiness 24/7 is not real. And for many, we can feel that joy. And we see that as an elemental component. And of course, we see that if an individual is okay, it's because we have the possibility of loving and working. It's a very simple definition. And we have some concepts or knowledge and experiences that we are going to experience that goes together of everyone. And of course, that help us to define and all of this intelligence that every human being had will be developed. And it's amazing because we're the only species that from the first years of our presence in Earth, we developed the capacity of thinking, of analyzing the language. So we have many lives that were losing, that were lost. So we have the possibility of developing it, and that should be our main goal in life. So we are insisting a lot of what human being has in terms of resiliency, everything that we experience, that sense of belonging, that sense of strength. And of course, we need to understand that when we have trouble, we might develop some capacities and we have skills to cope with this. And it's a creative scenario, and that might give us some defense mechanisms that will allow us to confront the difficulties that we all deal with.
Muy bien, la relación médico-paciente ha sido una cuestión histórica muy
And the relation physician-patient is an important component every time we are mentioning as a patrimony of humanity. And of course, this Sigmund Freud,
y del cuidado de las personas.
We're going to talk about psychology and how do they take care of ourselves.
De salud mental para los enfermos,
so the mental health care for the patient is to have a good physician-patient relationship, to have a good treatment from the entire health team, from the doorman, from the families, every auxiliary staff, and the attention. Healthcare services are really formed because sometimes you do it running after the order or running after an appointment that will come in months. And it's important to receive the information, and we will have, and of course we have a lot of family members that will help us to deal with the pandemic, that sometimes they are isolated. And I will finish with the importance of promoting mental health, to have campaigns about it. And of course, we will remind that this will be the best well-being insurance when we have good, effective relations, that we will develop our capacities of collaboration, of to have physical activities that know are the passive causes that I have a spiritual life, not only and growth of the sector as a thinking human being, that we have aspect of social responsibility, that we have also projects in life, and we forget about it. And to have access to including physical exam with psychological and psychiatric that are close to the possibilities of people. And of course, we will see that I will have the chance to respond some questions that I have about it. Thank you so much.
Muchísimas gracias, doctor.
Thank you so much, Dr. Álvaro.
Hemos escuchado la disertación del doctor
We
Álvaro
listened to the presentation of Dr. Álvaro Rodriguez that presented the main psychosocial problems of
Vemos el listado de lo que nos ha
our
presentado.
populations, and if we see the list of the issues, are not solved by problems of the health sector, and we see the importance of the intersectoriality and the approach from the social component, because as we mentioned before, they move away from the approach that we can call actions that we conceived for the health sector. We also listen to the paradox between the evolution of medicine and the quality of services and present to us what was the opposite phase of this medicine and health based on people, and that has the lack of humanization, and what are the resources that we can deliver for being close to that equilibrium state of mental health that is so important to be, that has to come together with the institutional capacities to make it possible. Thank you so much, Dr. Rodriguez, for your interview.
Estamos comenzando a recibir comentarios y preguntas.
We're receiving now some comments and questions, so we invite you to stay in the room, because at the end we will have some Q&A sessions. And now we have the presentation of Patricia Garcia, but also a problem of last minute, if she was unable to join us. And I would like to transmit her apologies, and I'm sure that we are going to receive her knowledge in a different meeting. So I will move to the next speaker, Ricardo Fábrega, a Dean of the Health Sciences of the Santo Tomás University in Chile. He's a physician, a master in management, member of the OPS and WHO, OPAHO and WHO consultancy. He worked in the central office of Washington of the WHO and worked from 1992 to 2014 in different different areas in public health networks and assistential networks. So I would like to give the word to Dr. Fábregas so we can see the presentation of Dr. Ricardo Fábrega. Thank you so much. I will share my screen. Do you see my screen, right? Yes, we can see it. Okay, fantastic. Thank you, Dr. Álvaro, because you mentioned some things that will save me some time in my presentation. And that's, of course, always useful, and time will be more effective. So I would like to talk to you about some things about the Latin American Patient Center, about the seminars, and I am preparing the event of Dr. Rodriguez in Bogota. And of course, we are keep reflecting about those issues. So the presentation that I would like to share with you is regarding public health and medicine, and some reflections actually, because we have a lot to discuss, and I will give some guidelines about some of the topics that will be more important in terms of what we consider health and medicine, in person-centered medicine. That is a term that we are supporting with a group of supporters. and the challenges that we might have in the future. So the first thing is to know what are the center health approach. And of course, this is not an obvious message. And we need to find out that when we analyze the classical definition, it was in the classical definition on Mercure, it was quite extensive. By public health, I would like to remind you that public health is the science and art of prevent diseases, extend our lifespan, and the physical information through the organization of the community. This is the first definition of mental health, but it is connected to those elements, to the control of infections of the community, the individual of health hygiene, medical service for the early diagnosis and preventive treatment of different diseases. And this is a very personal inclusion that will guarantee to each individual in the community a proper level. And this is a very wide definition. It's a quite interesting definition that will open many lines of work. And of course, one of them help us to define the public health arena in the 20th century. That, as I mentioned before, medicine is not a discipline that you might leave to be domesticated easily. And this could be submitted to things or thoughts of the public health personnel because they have their own line of development and they sometimes get to sub-specialize in different areas. So in terms of, in the case of public health, it happens exactly the contrary. While medicine was centered in the specialization of some concrete aspects that get to the fragmentation of medicine practice, in health used to concentrate their approaches to populations. Therefore, the PAHO definition, we see that public health, it's a collective intervention, both from the state and the civil society to improve the health of people, and yes, in plural people, and the collective action. So the study of the great cohorts, they lose sight of the individual when we say that it's not only worthy to speak about every single individual. We see that in the Peruvian culture, that people that is not so involved in the thinking of public health might imply that public health some spaces with macro policies, a lot of governance in regulations to prevent the consumption of tobacco and calories of ultra-processed food, and also a constant struggle of the food products industry and public health. And this is something that was left behind. And for us, this is a constant challenge in terms of what we can do, because we need that public health should be centered in people, not only that medicine comes back to people and stop dealing with diseases only, stop talking about the lady on the room 8, but talking about Lady Marie Carmen that is coming for a preventive approach. And this is something that we can establish as a public health approach, thinking about in the daily living, in a healthy lifestyle. There's where we are conducting our life projects. So when we talk about people and their communities, we're recognizing that human beings We are not individuals. We are relatable individuals. We are born in the birth of a relation, and of course we have a mother that takes care of us. And of course we can have many years until we are independent. And of course we take care of others as soon as we are parents. So it's true that we are.
Entonces, es una deriva muy fragmentadora.
So this is a constant philosophical reflection about individuals and communities. We are not living by ourselves. We are members of communities, and that's something that I have to reflect about in public health. When we live in communities, when we live in a cultural environment, and we live in a legal environment related with others, that's something that helps us to develop our life project. And this is something that might be important. So how can we move forward? Some tools come. We remind the national objective of public health, and we have the proper scheme that we use in Chile with an exercise of construction of a national strategy of public health. And of course, today our conceptual framework here is quite solid. The framework that I show you here includes the holistic approach of everything that is happening around the comprehensive care, and this comes to echo to the psychosocial spiritual domain because this is including a very extensive approach of the human being. And of course, we have some elements to build healthy environments. And of course, that we concern about emergencies and disasters, that we worry about this capacity for the environment. All these models are integrated in the National Strategy of Public Health. And when we behave with healthcare providers, and something is what we write, and another completely different story is what we implement in our public health policies. The experiences bring us some the similar approaches in some processes, and of course, the pieces that we miss are both from the macro and the conceptual domain, together with the concrete experience of forcing how people and their communities build healthy lifestyles, in how we eat, in how we live, in how we work, in how we love, in how we relate to each other, how we make possible the community health. And that's the objective that we are presenting from some time now. And the pandemic moved away from many reflections. I think that many experiences came out of this space. And of course, we have a reflection about what are the essential positions of public health. We have a very important discussion about this topic at the beginning of this century. We have some documents that were released in the public health arena. And of course, right before the pandemic, we had a document adapting the essential domains of public health in terms of the development of the Sustainable Development Goals, the Millennium Guidelines, and we have 11 new essential functions, and this might be reorganized around 3 access domains, 2 in development of policies. And for those who are interested in this document, this is available in the Pan American Organization of Health. And I think that this is quite interesting to orientate public health in the work that we have done in the public health domain in our countries, a very transversal agreement of the main public health schools in Latin America and the Caribbean, and also from North America. Now, what are the approaches that I would like to present to you this afternoon? I would like to to work in public health, but centered in the individual, in every single population, as the object of the analysis of the main character. And the subjects are people, communities, in terms of the possibility of having that people to live in a territory. And we need to remind that this is an holistic approach. We are not talking about material aspects and things that we can find, because we have political, religious, social domains that demand a way to know each other. And in our Americas, we were able to reassure how our communities live. So knowing that, required to develop coherent strategies, being support in that language, talking about health promotion. We need to talk about health genesis, that is the daily approach of healthcare. And if we go beyond that concept, we need to consider the citizenship, people that will participate in a social contract as autonomous entities, and people that take care of each other to make possible, to create possible, and we need to work in that line. And finishing and with this reflection or group of reflection that will give us space to a lot of reflection, those who work in universities had a huge challenge, because we see that the vast majority of the curricula of our situation in Peru and Chile, in the entire Latin American region, the vast majority of session goes sustained by the model centered in hospitals. The social production could be centered in people, communities, and so our universities build our prestige and our support from the biomedical approach. And even though it's not bad, it's insufficient. How can we produce safer treatments for infectious diseases? How can we overcome that? Can we deal with chronic diseases that have to do with cancer? So, in the need of a particular action, so we might be falling short. So, what is the dilemma of that treatment? That we are not always connected with the real social conflict, where these people are developing some diseases, because they are not floating in the air. They are involved in a society, involved in a community. And of course, this is something that is done from the biomedical approach. And something relevant in the communities, when we talk about the structure in community, has to deal with, and the comments might appear with something negative, something risky, and the profile to not include competence. And of course, there's a lot of wisdom, a lot of experience, a lot of daily practices that might be they are put outside the curriculum, and that goes as a parallel line of the exercise of profession. And of course, we will be extremely limited if we don't influence the quality of life of people. These reflections, of course, are not my own. They are conducted in one of the best universities of Chile, that is the University of the Territory, where we are extremely committed with some deans, not only in medicine, but other faculty, but other schools. occupational therapists, physicians, engineers, kinesiologists.
Nos hemos comprometido a ir modificando nuestras mallas.
And we committed to modify our syllabus to deal with the community healthcare, and of course the effort to support the developing communities from their potential or their real potentialities. And this is something that I wanted to share with you. We want for public health to be centered in people and not only in medicine. When we have the role of the medical physicians having human realities, but also we would like to include other groups in service of the comprehensive medicine and a relational domain that help us to live in communities, and those who work in health will be able to work together. Thank you so much for your attention and my deepest gratitude from the University of Santo Tomas in Chile. And if you have any question, I will be happy to answer them. Thank you so much, Dr. Fabregas, for your presentation. I will stay with some ideas that we emphasize. And of course, the objective of public health are people that live in communities and not the other way around. And of course, it's not like a single unit, leaving behind that richness of what different individualities could add up from the relationship of the territory. And that's why we insisted in the way how we implement and defend the implementation of health in our territories, concrete spaces, beyond the solid theoretical framework. So thank you so much, Dr. Fabregas, for your intervention. We received a lot of comments and questions, so I will formulate one question, and we can decide how can we feel more comfortable to defend it. And of course, I will be extremely thankful if we can discuss about these issues in a reflective manner. They are quite challenging questions. Many of them said to implement this medicine center in people. Do you consider that we need to create different systems of evaluations that will force the creation of standards and respect to the rights of patients and family members? There's another quite related with this one, that we can solve them by the change of curricula, the deshumanization. And I will formulate a third one. What is your intervention or normatives that we can have as a balanced equilibrium of a medical approach centered in the health authorities? So we have three questions that are more or less on how do we do it. How can we make that this is something that we appropriate this need of change it into another logic in a more human strategy and response to the integrative approach of.
Escuché entrecortado la primera. Si me la podría repetir. Eso, acércate bien al micrófono.
Bueno, creo que estoy cerca.
Ahí sí, no, que como cuando hablas para el lado, como que cuando estás leyendo hacia el lado, se va la...
Ok. Es que unas las tengo en el teléfono, otras las tengo en la computadora.
One of them I have it in the telephone, so the first question is, if you consider that to implement center for medicine, do we need to apply systems of regulation, of evaluation, of performance, cameras that might force the respect of people and their family members. We think that this might be a pathway. And the second question is, if we solve it by a change of curriculum, this humanization, and the third one is, which interventions or norms can we have to develop a balanced development of a healthcare attention center in the individual in relation with the terminologies of health? I think that the questions are quite related because we need to solve how can we walk into that direction. So please, this is open for comments.
Debate, me refute y aquí discutimos.
Con mucho gusto, maestro Ricardo. Tanto como refutarte, no, pero sí.
Complementaria. Oye, bueno, a ver, respecto a las herramientas,
Well, regarding the tools, we can do this project of recognition of events. We promote a notification project for the patients that we presented in 2005, 2004. I'm talking about the beginning of this century. And it was recently approved. And giving rights is complicated. So we see that health officers, the medical school, the medical association, to comply with that, we need to demand this or that condition. So we have a lot of debate. How can we keep up the privacy? So it was a group of rights from the patient that at the end of the day become a legal norm and part of the regulation process. We need to comply with the rights and duties of the patient if we are not able to exercise our. So we don't have a perfect solution. And of course, that goes together with the ironic answer. Do you think that changing the curricula, you were going to finish with that lack of humanization? Of course not. But that might contribute if we don't do it that way. We think about diseases and not people. Of course, that we're going to contribute to the dehumanization. And the other way around, if we only think about people without their context and the context in their communities, of course that we are going to contribute to humanization. And the cultures that are inserted in the hospitals, and sometimes we work in a very violent environment.
A veces llega exigente, a veces llega violento.
Sometimes we have violence, sometimes we have very hard comments in the public health domain. Therefore, there is not a single magic solution, but we need to find an echo, a culture, a conviction that we cannot normalize dehumanization. And of course, as we move forward and we see other tools and we improve the training of human resources and we see an improvement of the users from other models that are not a client-provider relationship, we can establish long-term relationship of mutual care. And there, where we are going to build a modernization process. And of course, we need to move away from the mercantilization. And that's why it's so important to have a strong primary healthcare when we have a strong contact with health that goes together with us. And those systems were not able to do it because this is not only poetry. those systems that make it possible people live better and longer. We have an improvement in the quality of life, a reduction in violence, and of course in the professional domain as well.
Del maestro Ricardo Fábrega. Yo debo
Thank
decir,
you, Dr. Ricardo Fábregas. I need to say the following. Of course, that everything that is related to publishing laws and papers are extremely basic components. And of course, we need those legal reference to be
y todo lo
able
que
to
sea
practice our medical practice, and everything that is related to debate has to be limited in laws. Here in Colombia, there was approval of the mental health services. And here my question is a little bit the methodology, because we have laws and the application of this, we see the mental health situation. And I have two aspects that I want to mention. And I will call it the voice of the patients. What happened with patients? Patients talk to the physician, and that's the entire participation in the clinical record. This is called clinical record, and that takes one or two notes. And of course, this is something that was created from physicians. And of course, we are in the need of listening to our patients. And this is, of course, an aspect that has to be increased in every single domain. And of course, in buildings, in clinics, something that I see in Colombia, there are the consults and suggestions. So we have a practical item, and we need to give more space for the voice of the disease. That we understand that something is to be a physician, and of course, if we are going to give the possibility to the patients to talk, to tell our stories, and of course, we move our medical knowledge, dynamic and scientific domain, and make it human. It also means that we should honor our patient. Of course, another aspect that is related to the curriculum framework, I have reviewed the curriculum of many schools. What are the objectives of our, and I don't find, and this is an aspect that I would like to mention, that is the medicine center in the individual. And of course, includes the physician. So where are we? In which curriculum do we have as a main objective?
Antes de medicina aprendan a cuidar
The medical students will learn to take care of their own health. So one of the issues that we are managing during the last years was the health of the healthcare of the health care personnel. And sometimes we become heroes, yes, but at the same time, in the self-care domain, we live with a huge disorder. So we also need that medicine is taking care of their own physicians. We need to talk about mental health of physicians that are submitted to extreme stressors when we practice our profession. And of course, we forget about the individual and we don't even, and this is be an objective, fundamental objective, and of course, we know about the pathologies and procedures, and of course, the medical student should know how can we generate our own health. So that's why we use technology in the teaching about these topics. And we forget about the physician. Physicians are forgotten. So this is an aspect that needs to be taken into account. Founded the technology as well. And technology is a fantastic tool because we have to teach our people that is what is more human than an aesthetic, for example. Before we operated our patients bleeding that was extremely terrible with a person completely aware. So technology is something that is fantastic. We need to teach our patients because we will do resonance. We will see possibility of teaching them. How we deal with these issues. So we need to analyze those options in those parts, and we can be aggravated with a claustrophobia. And technology, of course, well used, is a fantastic tool.
Muchísimas gracias a los dos.
Thank you so much to both of you. I will then give some Q&A that might seem simpler.
Ya. Una de ellas dice,
so one of them is, should we promote in universities and services more qualitative research about how the patients feel?
Otra pregunta.
Another question is, who are the main allies to develop the technologies and mental health components along the life course? And the third question, and with this I will close.
Una próxima pandemia y que hay una gran probabilidad de que pueda surgir.
There's a huge probability that we might have this from a zoonosis. Which challenges will this represent for the exercise of medicine and public health centered in the person? These are our three questions, so we can dialogue about them close to the closure. The last one is for an entire seminar, so that's we can write an entire book to try to respond to that question. And Alvaro, can you start? Well, the pandemic and to generate the zoonosis is something that might be incorporated into and this includes to analyze the health systems with a huge functional reserve, with a great capacity of growth, with a great capacity of changing our shift, our chip to shift our approaches in peacetime.
Y que todos los profesionales de la salud estén seteados así. Para
every health professional established that
y por lo tanto todo sistema de salud tiene que estar
during the pandemic I was in charge of emergencies, and we need to be ready to confront tension moments, the resilience in health systems, and I say it in a way that economists feel offended. The inefficiency by design, and human beings to survive wanted to be efficient. We only have one lung, not two. We only have one kidney, not two. Why do we have two? Because that's how we survive. in our daily living, we know that we can survive with one liver, with one kidney. But to survive is better to have a second or maybe a third one. So we have been evolving to survive with what we call the functional reserve. And the health systems, especially the public health systems, will work underneath their demands when they should be in top of their demand, at least 20 to 30% of inefficiency by design, and try to tell that to the Ministry of Finances. When we receive a request from the military to buy 3 tanks, they will receive it. But when we ask for budget to improve our hospitals, we have to struggle. So this is something that we have to be fair with the entire community. As we are extremely hard to demand for coherence in the decision makers, especially in the strategy domain. And of course, that will give us time for books, for seminars. That's my opinion. And I just want to share that. So that's regarding the first one, to promote research on the clear feeling. And I'm sure that I am a little tired that my people only are aware of the papers that are published in the super journals. And of course, I would prefer research that is honest and will help us to our communities, because otherwise it's extremely difficult because we have a colonialism. If you don't put an English last name in the first author, it's extremely dramatic. So look for the most German last name in Chile to have best possibilities for the publication. So the intellectual colonialism exists. The intellectual racism exists. So the other is just closing your eyes to the reality. What is the level of rejection of our stuff? So I can assure you that if we change the order, and so we are asking our academics to be aware of the local publications. So this is very interesting. And the true thing is that in the universal context of science, the Hispanics are not in the first, or we have to be in the third or fourth line. So I would like to mention 2 specific aspects regarding the pandemic. We need to prepare. One of the preparations that we have to do is to gather all the testimonies of people from the pandemic. Because when we talk about the Spanish cold, so we need to gather all these past experiences to deal with new guidelines for the future generations. So regarding that, you know that I have written 58 books, and the next book is called The Human Soul. And I gather the experiences of many people. How do they experience that, and what are the possibilities we have? And of course, we discussed about that in a meeting of zootechnicians dealing with a reactive situation of rats and cockroaches. And there where we see how these possibilities are solved about these horrible pathologies. So regarding the allies of mental health, what a fantastic question, because there are allies are all of us, because we need to talk about the individual human being. The effective support by the family, by our friends, that are known individuals.
La salud mental. Es que muchos de los problemas que
It's
uno
a
ve
fantastic alternative to
emocionales están relacionados con lo siguiente.
these are related with knowledge. People that do not have who to discuss with, to question about the difficulties in what we have, and convulsed world that one we have. And if we don't
Pero es que
take that away from our system, that will be a constant struggle. We have to be allies
dramática, negativa, sobresaltante.
because we have too much of dramatic TV, aggressive situations, and people ended up extremely affected by these type of situations. And people that do not have access to psychiatric treatment, we might have some issues, but we all have a psychotherapist, and in fact are free because there are some specialist physicians that we can deal with our knowledge. So we need to look for that serious and also advisors. Priests, not many people could help us to change that mentality, but you need to be careful about
Insisto, porque me toca
originally work, and I insist because I need to serve many physicians.
una serie de presiones
We were able to add to them some sacrifices and tension, and of course they don't have someone to discuss with.
Bien, muchas gracias.
Excelente.
A mí se me acaba el tiempo. Tengo que irme a otra cosa.
Sí, sí.
I'm sorry, but I have to leave you now. Yeah, sorry. We are going to wrap up. We don't have the possibility of having Dr. Maricán Bencalle for the closure, but this will be possible to close this session. Because I have a question that talks about a category that was quite similar to the one that, and this is something related to the limits.
Consciente de que se está quedando un porcentaje importante de la población.
And this have an important that the population has to be served, and we might talk for the entire evening.
Que vayamos cerrando y
but it's time to wrap up. So I need to thank all the people that is connected, especially from the ministries of health and the academy and the different organizations. We have people from many countries, from Argentina, from Belize, from Bolivia, from Brazil, Chile, Colombia, Cuba, Ecuador, Spain, Guatemala, Mexico, Nicaragua, Paraguay, Peru, the Dominican Republic, Uruguay, Venezuela, and we have receiving regards from many places. So we like to thank you for joining us. And of course, we have some comments and questions without responses, and so that's how we will say goodbye. I would like to thank you and send our deepest gratitude.
Por acompañarnos, sus felicitaciones.
In regards from María del Carmen Calle, her congratulations for the Peruvian Medical Day, and the next Wednesday at 6 p.m. Peruvian and Colombian time,
tendremos un webinar muy interesante que
we will have a webinar quite interesting that is called Mental Health, extremely important for the empowerment of our patients. So have a wonderful night and see you soon. Thank you.
Muchas gracias. Fueron muy